Hello, this is Dr. Sabyasachi Basu, consultant plastic surgeon, Narayana Hospital, Tagore Hospital, Mukundapur. And today we have with us famous consultant oncosurgeon, Dr. Gautam Mukhopadhyay. Hello, consultant oncosurgeon, Narayana Hospital, Tagore Hospital. So on the occasion of World No Tobacco Day on 31st of May, we would like to ask, sir, about the impact of tobacco on oral cancer.
Tobacco, the other name is really cancer, because around half of the overall cancers are some way related with tobacco use. And oral cancers, so far oral cancers are concerned, 91% of cases are some way related with tobacco use. It may be smoking, it may be chewing tobacco, it may be brushing teeth with guraku, that's a form of tobacco, or using noshi, or it may be anything, tobacco in any form. And if anybody uses or intakes alcohol regularly in addition to use of tobacco, the risk is not double, the risk is tenfold. So oral cancer and tobacco go hand in hand, and there are many cases where there are pre-malignant lesions like white or black spots in the oral cavity, or you could have a smaller mouth opening called submucous fibrosis. So if your mouth doesn't open or you have such spots in the mouth, then consult your doctor. So I'd like to ask you, Sabyasachi, that in case of oral cancers, most of the cases we tend to operate the patient and the patient undergoes surgery. So after undergoing surgery, people are very much worried that what will be the outcome and how the patient will look. People used to fear surgery because it will give a gruesome look to the patient. Can you throw some light on that?
As a plastic surgeon, sir, I would like to tell that it is not so gruesome anymore. We have in our armamentarium, there are many different methods in which we try and almost restore the original look of the patient with minor scars here and there. But then again, with respect to the tobacco usage, we always would like to reiterate the fact that with tobacco, wound healing is very, very impaired. We do the flaps and the healing of the wounds is very delayed. The reason being long-term tobacco usage. There are other multi-speciality problems with tobacco, and hence tobacco usage should be stopped ASAP at all times whenever the surgery is being applied.
I totally agree with Dr. Basu that use of tobacco, everybody knows that tobacco causes cancer. It's written everywhere. But still, people use tobacco. And chewing tobacco is a problem not of the Western world, it's a problem of India and the subcontinent, that people still chew tobacco. So if you have any ulcer in the oral cavity which is not healing, or any growth, or there's bleeding from the mouth, there's bad smell, or you have a sharp tooth, you consult your doctor. In all cases, it may not be cancer, but sometimes it can be cancer. And if it's detected early, you can get fully cured. So I'd like to ask Dr. Sabyasachi Basu that in many cases in oral cancers, we remove a bone which is called the mandible. It's right here, the mandible. Or we remove the whole tongue. So people get worried that if you remove the bone, what will happen? Will it look odd, or the mouth will go, face will go in? Or if you remove the tongue, do you have any ways and means by which the patient can talk and eat later on? Because the fear of cancer or cancer phobia is sometimes worse than the disease itself. So what is your opinion?
With the advances of reconstruction, there is no reason to fear anymore, because God has given us an extra bone in our leg, which plastic surgeons take them out and they modify it to form the bone in the cheek or the chin, and then accordingly they create a new jawline, and it looks almost as it was, as it used to look before. Whether it is the tongue, then we take out a flap from our thighs, and then again we create the shape of a tongue accordingly, and it looks as good as before. So there is not much to decide between preoperatively and postoperative results, and hence I feel that one should not fear surgery at all, because good results are achieved by surgery.
In decades of in this, I would say in this discipline, what I've seen that when a person has a growth or cancer, somewhere in the tongue, they always are worried very much regarding speech and swallowing. So speech and swallowing are the two important functions of a human body. And if they are affected, then a person cannot work in his office in the proper manner, or he cannot eat well. So do you think that present reconstruction can alleviate this sort of problem?
Yes, sir. With reconstruction, the speech as well as the swallowing function is brought back to its almost near normal types with the free flaps that we can do, that we are doing almost on a regular basis. Almost all of our patients do not suffer from any speech or swallowing problems.
And the last question to you, I would say that you see, we are a poor country and we are not that rich. All people are not that rich. They don't afford. So, is the cost of treatment, especially reconstruction, which has come up in a new way, free flaps and all that, are they very costly? Is it possible to be done for all?
Reconstructions are for all.
Do you have anything which can be done in a much cheaper format? A local flap or something? Because you see, cost, economic issues are big issues. And you see, financial anemia is also a disease. So, what is your take on that?
Absolutely, sir. When the finances are concerned, then sometimes we tend to avoid flaps taken from the thigh or the leg. But there are other options like flaps taken from the chest or the neck, or local flaps taken from the oral cavity itself, which are all obviously less expensive, and accordingly reconstruction serves all and it treats everyone equally nicely.
I think it's a very good answer. I would just have to tell everybody through this video that avoid use of tobacco in all forms, because once you have oral cancer, it's not only the cost, it is a sort of a harassment for you. So, and if you have any ulcer which is not healing for a long time, it is small, and you're having bad odor from the mouth or a sharp tooth, get treated. Consult a doctor, because sometimes you can have early cancer, and for that you don't need much of a, there's not much of a problem, not much of a defect, and you will be absolutely fine. Thank you.